Our guest today is Dr. Antonio Allegretta, a renowned expert in cognitive behavioral therapy and hypnotherapy, based in the picturesque Pistoria in Italy. Dr. Allegretta not only is the president of the Institute of Studies on Hypnosis, but also a member of the European Association of Professional Hypnotherapists. That's EAPH.IE. Dr. Allegretta will share with us his extensive experience and will discuss powerful yet under-recognized treatment of hypnotherapy for fibromyalgia, a condition often triggered by psychological stress. He emphasizes the importance of balanced life approaches, mindfulness, and the necessity of proper education in managing fibromyalgia. You'll hear about the intriguing case study, which is the subject of a published paper by Dr. Allegretta. He also will focus on the skepticism surrounding hypnotherapy, arguing convincingly for its scientific basis and real-world effectiveness. Tune in today now as we explore the intersection of psychology, hypnosis, and holistic health with Dr. Antonio Allegretta, all on today's Professional Hypnotherapist podcast. Dr. Antonio Allegretta, welcome to the Professional Hypnotherapist podcast.
Thank you, Aidan.
And it's really wonderful to have you here today, and thank you so much for your time, all the way from Italy. So tell us, where are you in Italy?
I live and work in Pistoria, about 30 kilometers far from Florence in Tuscany. And yes, I'm the president of the Institute for Studies on Hypnosis, Istituto per gli Studi sull'Ipnosi, mindfulness, and complementary therapies.
So you're teaching that there?
Yeah, sometimes I teach too.
Oh, okay. All right. Okay.
But especially is a place, it's something that is devoted more about research and therapy than teaching.
Oh, okay. Research. Excellent. And you recently become a member of the European Association of Professional Hypnotherapists.
Right.
What was the motivation there, Antonio, since I know it's the European Association, and, what was the motivation in seeking membership there?
But actually, I started in UK before Brexit.
Yeah.
And so after Brexit, UK went out of European Union. So I needed a professional association in a country that was member of the European Union. This is the legal aspect. On the other hand, I like the name European Association of Professional Hypnotherapists. So yes. I was interested in staying in a very large network of hypnotherapists all over Europe. And about that, I checked the website and I saw that you're really hard professional. You do things very well and and hardly and strongly. So I said, well, this is my place. I liked also the fact that you have a general meeting every year where there are so many speakers, so many people that come all over Europe and bring many their experience, and they share their experience, and so that's really important.
Well, we're absolutely delighted to have you as a member, and thank you for being with us. Now, in terms of your own background, just give us a general outline of your own background, if you don't mind.
No, that's okay. Well, I think many of people that become hypnotherapists or psychotherapists, I come from personal story of sufferance of, you know, my background is a scientific background. I studied physics at university,
Okay.
but at a certain point, I left everything and I moved in another way, studying psychology at the University of Trieste, and uh, trying to find something that could help me with my personal problems. I started to read something about self-hypnosis. And I was so impressed about that.
Yeah.
And that moment, I was studying, I remember I was at the first year of psychology at university. And so we studied dynamic psychology, Freud, and conscience. And when I did some exercise about self-hypnosis, I said, wow, that's the unconscious, it exists, it really exists. That's fantastic. And so from that point, I started to study hypnosis because I saw that it was very effective. It was very quick. It it could have been a very good tool for me to make um, very good results, very help people that needed to have great change in their mind, in their life, and in their body too. This is the other important thing that uh, maybe sometimes we miss. In the in the in the field of the medicine, I remember it was about 10 years ago that the BBC reported the suggestion of the Royal Society of Medicine. They said that the first intervention should be hypnosis. And then from there, see what else. Not starting with drugs, but first with hypnosis. So think about migraine, think about anxiety, and so many other things, so many other problems.
Yeah.
And
You know what?
actually, yeah.
Sorry, go ahead.
No, no, actually, we miss a lot of opportunities with hypnosis, thinking that hypnosis is just a psychological thing or maybe regression of past life and so on. Hypnosis is a very useful tool for a lot of problems in the medical field, asthma, fibromyalgia, migraines,
Yeah.
even rehab. You have a trauma, your arm broken. Well, rehab with hypnosis is very useful. Or you got a ictus and maybe your arm is not working better anymore. Well, you can improve the rehab through hypnosis.
Yeah.
There are a lot of research on that. And unfortunately, hypnosis is still something that is kept in a corner, like something mysterious or something that, yeah, okay, but
Do you think, Antonio, that the orthodox medicine will ever really accept uh, hypnotherapy per se?
sorry, say
Do you
again,
think
please.
that orthodox, like the medical profession, will they ever accept, hypnosis per se with lay hypnotherapists?
I think that as a medical doctor, your first aim is to help people, no matter what is the tool that you use. And in the very moment you know that hypnotherapy is something that is scientific based, is not something strange or whatever,
Mm.
but that it gives actually real results. it's a shame the fact that you don't use that. And, you know, there is the business of drugs, there is the business of many other things, but, you know, there are some problems, some syndromes, some pathologies that have no cure with drugs, but can be actually fixed through hypnosis.
Excellent. The psychosomatic aspect of illness.
Yes. For example, fibromyalgia,
Yeah.
migraines, and so on. I'm sorry for my English.
No, that's fine.
Sometimes I'm a bit uncertain of the right word to use, but
well, please forgive my
it's a long
no
time
Italiano.
it's a long time that I'm not traveling in UK, or in Ireland, so my English is not so fluent.
Well, you do know that the best English is spoken in Ireland, but anyway. No, Antonio, thank you for that. You mentioned earlier about the institute that you have there in Pistoria, isn't it Pistoria?
Yeah,
And as part of that institute, you mentioned you do research,
right.
and you have published a paper
Yeah.
on hypnotherapy with regard to fibromyalgia. Tell us about that, please, and what was your motivation there?
Well, I met a rheumatologist, and I said, you know, and she spoke. She told me about fibromyalgia, and I said, look, hypnosis. It's very useful to fix so many things. So I will check if there is anything about hypnosis and fibromyalgia. So I made a little research on PubMed, and I saw that there were plenty of studies, plenty of research about hypnosis and fibromyalgia, and that hypnosis actually worked for fibromyalgia. We have about 40 years research that they say that hypnosis is really effective in the treatment of fibromyalgia. So I started to work with her, and that was the first case that I treated. And it was very interesting because that guy was suffering from fibromyalgia from a long time. Nothing worked with him. And if you reading the paper, you will see that at a certain point, all the symptoms disappeared after past therapy. He had spontaneous regression with every action. He fought in tears, and then everything stopped. He had no more problems. He had no more pain. He spent years going around physicians, was treated like, this is just imaginary hills. You have nothing. Don't bother me. Well, okay, you go to the osteopath, you do that. And so he was actually desperate. He didn't know what to do.
Yeah.
And after that, everything stopped. He had no more problems. And so I was, that was the first years, a few years after I got my diploma in hypnotherapy in UK, and I was a member of the Old National Council of Psychotherapists, and so I decided to write that article to give evidence to this. But
Excellent.
unfortunately, I must say that I have found a lot of resistance on this problem, because I must say that they have built castles on fibromyalgia.
Right.
And so they are afraid had the idea that just hypnosis would be enough to sort out the problem, because otherwise, all the business that they have created about fibromyalgia, drugs, psychotherapy, osteopaths, nutrition, and all whatever. Uh, in Italy, we say, I don't know how things are in Ireland, but in Italy, we say that it's the new golden chicken eggs, la gallina dalle uova d'oro. It's a chicken that makes golden
Oh,
eggs.
yes.
So there is a lot of money, but the point is we don't look for money. We look for people having back their life.
Yes. Yes.
So
Now,
this is my battle. This is my fighting.
yeah. In the particular, the subject of your research, he was a young gentleman. Tell us about nothing personal about him, of course, but just his background, if that's of any significance in your opinion, and his age.
Oh, he was 28 years old. But first of all, fibromyalgia is something, is a symptom that affects, in the majority of cases, women. So 19% are women that are affected from fibromyalgia. So a young man, 20 years old, affected from fibromyalgia was something absolutely new, or not so, something rare,
Common. Yeah.
not so common.
Yes.
And well, there was anything that at the beginning there was it seems like fibromyalgia, like other. He started to respond very well to suggestion hypnotherapy,
Okay.
because just suggesting hypnotherapy helps the body to take back the equilibrium of the in the producing the hormones.
Yes. Yes.
There are some research that show very well that hypnosis helps to take back the equilibrium in the hypothalamus hypophysery axis,
Yes.
HPA, right? So, and we also have some other research that using hypnosis every day on a daily basis, recording hypnosis, self-hypnosis through an MP3 file, right? Helps to clean the mind, the prefrontal cortex, from the excess of cortisol.
Okay.
So hypnosis works not only on the psychological side, but also on the body side.
Yeah.
And the really interesting thing was that everything disappeared. All the symptoms went away, disappeared after that reactions.
So when the gentleman came to you, consulted with you, you obviously, you took the history and you then charted for him a program of hypnotherapy, um, which initially you just started out using um, suggestion hypnosis.
Yeah,
And a component of that, of course, is relaxation. Would that be true?
yeah. First, relaxation, ego strengthening, pain management, suggestion hypnotherapy for pain management,
Yeah,
suggestion hypnotherapy for anxiety,
yeah.
manage anxiety, uh, and suggestion hypnotherapy to sleep better, to better sleep in the night. And
And then,
also
of
I
course,
get, right, sorry.
And then, of course, you then went on to do parts therapy.
Yes, because symptoms didn't go away completely. So I didn't know suggesting hypnotherapy was not enough.
Yeah.
And then I decided to use pulse therapy.
Mm.
And in a very simple way, and I was lucky because he had a spontaneous regression. So I didn't have to work so much with pulse therapy. So like negotiation or so on, everything came up spontaneously. He had that
Yeah.
spontaneous
Abreaction.
regression without reaction. That he remember the real origin, the real cause of the problem that was being left from his girlfriend. Uh, uh, there was a girl. They they lived in a kind of symbiosis because they studied together at the elementary school. They stayed together at the elementary school in a very hot town in the mountain around Pistoria. So they lived together. And at a certain point, she left him, and he felt the ground crashing under their feet, under his feet, and. And from that point, fibromyalgia started. So when you remember that and this
Yeah.
kind of trauma arise at consciousness, at the conscious level, he had a reaction and everything went away and she get completely recovered.
Yes.
He got
And
completely recovered.
yeah, the 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 his symptoms seem to have arisen as a result of his breakup from the girlfriend. Isn't that correct?
Right?
Now, you said they had an abreaction. Was there, in your opinion, or could you identify an initial sensitizing event, a very first event back in childhood, or was it all got to do with the breakup?
Oh. The initial sensitive event was the fact that his girlfriend left him.
Okay.
That's it. It was a trauma.
A trauma, exactly. Yeah, yeah. Okay. Now, that was excellent work. Do you recommend, in your opinion, the parts therapy for other cases of fibromyalgia?
It depends. I think that in the majority of cases, and also as scientific research show, suggestion hypnotherapy, a training with suggestion hypnotherapy and some CBT coaching is enough.
Okay.
If there are still problems, then we need to fix and to see what is going on. And then past therapy or regression, hypnotherapy, every kind of analytical hypnotherapy is useful to fix that because the fibromyalgia starts from stress.
Yeah.
No matter what is the reason, fibromyalgia starts from stress. It can be your psychological asset. Let me go. Maybe you're very anxious. Maybe you have in some part of your brain the idea that you have to do everything quickly and right and perfect every time. Maybe you had a trauma. Maybe your environment is very stressful. At a certain point, your brain says, stop, it's enough. I cannot do anymore. And then you start to feel pain all over the body, fatigue, you don't sleep well, you're unable to do anything. And in the worst cases, even being touched, gently soft, produce pain in your body. Okay. So, in a first moment, suggest an hypnotherapy with some CBT coaching to help the client to manage stress, to understand that his life must change, that they need to have a more complete way of life, not only just house and work, work and house, but even social life, sexual life, sport, spiritual life, and so on.
Holistic, yeah, viewpoint.
And also manage their emotions, their feeling. So I also teach them problem solving, how to manage their emotions, helicopter view, this kind of exercise from how to manage situation, how could do that. So everything that creates stress. And I teach also to pace their work. They don't know to pace their work. They just run and do without stopping.
Yeah, yeah.
Because I work in Italy, and we know we are in Italy very devoted to cooking, and and because the majority of people affected from fibromyalgia are women,
Yes.
I say, look, you cannot cook everything with high fire. Otherwise, you're going to burn everything.
Yes. Yes.
So there are some things that need to be cooked with a small fire, like risotto alla milanese. And when you have to cook a big steak, then you use the high fire. But if you use high fire for everything, then you're going to burn everything, right?
Yeah.
A fibromyalgia patient are like they are cooking everything with high fire.
Yeah. 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 So there's a tool for everything, a specific tool for everything.
Right.
And it's in your work, you mentioned that you uh, teach mindfulness and the benefits of mindfulness.
Yes,
Would
yes.
you comment on that for just briefly about mindfulness?
Well, actually, mindfulness, there are a lot of research that show that make uh, the brain cortex thicker, right? And this part of the brain is the part of the brain that helps to keep everything in control. Emotion,
Prefrontal cortex.
right?
Yeah.
Pain. So mindfulness helps a lot with stress management,
Yes.
with managing the emotion, being self-aware, not being, completely uh, in the chaos of our emotions and thoughts. And also, mindfulness um, produce physical effects in the brain, like making the cortex, the brain cortex, thicker.
Okay. Okay. Excellent. Um, how significant, in your opinion, is training for hypnotherapists in hypnoanalysis? What's your take on that?
I think that it's actually a very good, useful tool. Um, at the beginning of my career, I didn't use so much regression and hypnoanalysis because I must say I was afraid of a reaction, of re-traumatizing, sorry, and so on. But actually, I have seen that there are no dangers, and there are no real dangers. Yes, we are careful. We are we have respect for our client. But using those techniques actually helped me to sort out, to fix a lot of problems very quickly and without stress for myself.
Yeah.
Because it's the unconscious that say you where is the problem and where it starts from. I don't have to think about anything. If you use just hypnotherapy suggestion or other tools like CBT and so on, you have to think about what could be best and teach them and so on and blah, blah. So, but all those kind of techniques like regression path therapy, hypnoanalysis, actually, it's the unconscious that says to you, where is the problem and what is the problem? And when this memory comes at the conscious level, and you have reactions, everything sorted out, fine, perfect. It's the easiest and the straightest way to fix a problem.
Excellent, thank you. Going back to your paper, reading that, I noticed that on one occasion that the client's right shoulder continued to have pain. Is that where you mentioned that the symptoms persisted and you overcame that by the abreaction? Yeah?
Yeah. It was, I no, I don't have the paper in front of me, but I remember that at a certain point, the symptoms didn't go down after a certain level. So I decided to use that path therapy to fix, and it was successful.
Okay. Would you, if you had the situation again, would you have done anything differently?
No, actually, my way of working with fibromyalgia has already been the same. I initially use hypnosis, suggestion hypnotherapy, and some CBT code because apart everything, I think that it's very important that the client learns some techniques to help themselves. So like self-hypnosis and some CBT tools to manage their emotions. So it's useful anyway. But if at the end of the treatment there is still something that doesn't work, then I use some analytical tool.
Okay.
But I must say that generally speaking, everything is sorted out by just suggesting hypnotherapy, deliver the client MP3 file audio to listen every day. So have self-hypnosis every day. It's very important.
Okay.
Signing every day, making a little table where the client sign every day the level of the symptoms.
Okay.
And this is very useful because that keeps the client aware of the process. And also we can see what happens if the symptoms, the level of the symptoms arise. So maybe they come back after a week and I say that symptom arose. And then I said, what happened? Oh, I had argument with my husband. Or I felt so well that I decided to clean all my house. Oh, well, I look. Now you better understand how fibromyalgia works.
Yes.
And now you understand much more better how to, the importance of facing your physical efforts, the importance of managing your emotion, the stress, and so on.
Okay.
So
And
it's an educational job.
yeah, and touching on that, you mentioned earlier about, almost teaching the client life skills. And I think one in particular, something that strikes me is the area of, giving things perspective.
Mhm.
And would you comment on that?
Sorry, just say,
Giving things perspective, putting the thing, in other words, when in your research, your client, you put the client out, I think out in
right?
space.
Yeah.
Yeah,
Some
perspective.
CBT exercise, like
Yeah,
helicopter view, see things from maybe the high of a mountain and
yeah,
see things from another perspective, being
yes,
detached from the
yeah,
situation that are making you uh, crazy, that are making you um, angry or anxious or maybe you can imagine yourself to stay uh, so far in the universe and so far from the world and
yeah,
see everything from that perspective. So now, how you can see your problem? How do you see things? So changing perspective, or maybe another one in my position, how would have sorted out that other people out from outside, how would have solved that problem, and then the end, the wise mind, the complete perspective, the
yeah,
more general picture.
yeah, yeah. Yeah, so you're bringing into your conscious awareness those aspects of reality that you're not currently conscious
Yeah,
of.
yeah. But also, it's an empowering
Yeah,
work. You make the client, you give the client tools to help himself.
yeah, yeah,
So when they leave my room, when they stop the treatment, they have a lot of resources. They have a little book with all the records, with all the papers, with all the handouts. So they have a kind of emergency book.
yeah, yeah. You also, in reading your paper, there was a mention there of the client changing their diet.
Yeah. There are some useful complementary food that are useful to suggest, like magnesium. Magnesium is the first important
Okay.
because we know that there is a direct correlation between magnesium and stress, anxiety, and depression. The more anxious, the more depressed, the more stressed you are, less magnesium you have in the cell body.
Okay. Great.
So this is very important. Vitamin B, of course, it helps with the nervous system. Omega-3 is a natural antidepressant. It's the best food for your brain. So you in Ireland are very lucky with all the fish that you have in your sea. I still remember fish and chips.
Of course. Yes. Yes.
So
Uh, fish and chips.
this is you know this is the most important. This is the most important thing you need.
Yeah.
And
It's
yes, even uh, have your gut working properly working. I suggest also to use lactobacillus,
yes.
things like that, to have a gut that works properly because we know that there's a direct connection between brain and gut.
Absolutely.
So
Yes.
if the gut works properly, we have a brain that is
Yeah.
more
On the
relaxed.
gut-brain axis, I think they call it. So, Antonio, if there was one final something that you'd like to impart to our listeners and to our viewers, all the way from Italy. I know it's not a million miles away, but give us something that you believe is that really important for somebody out there listening or watching who may be currently, um, experiencing elements of fibromyalgia. And of course, there's another thing, myalgic encephalomyelitis is sort of similar to that. Would you give us some little words of wisdom, if possible, please?
Well, uh, fibromyalgia is not a so big issue. You can recover from fibromyalgia. We know how.
Mm.
There are 40-year research that hypnosis is the best treatment, I could say,
Yeah,
for fibromyalgia.
right.
So
Wonderful.
the problem is that physicians don't know about hypnosis and fibromyalgia, or maybe they don't want to know. Uh, so what could I say to someone that is affected from fibromyalgia? Don't be desperate. Don't lose your time on Google and with social groups. Just look for a hypnotherapist that work with fibromyalgia
Yeah.
and go through that and go ahead and you will recover. Maybe you will need some help, some drugs, but you can have your life back. Not following um, that way and losing your time on Googling or staying in social groups where everybody cry and say, yeah, I have that and I have that. Oh, yeah, that's a shame and blah, blah.
Absolutely, yeah.
Don't waste your time. Don't waste your time. Just look for a hypnotherapist that work with fibromyalgia.
That's
It,
one wonderful
it,
advice, Antonio.
it's not a so big tragedy. The problem is that they have created a tragedy
Mm,
because there is a lot of business involved, and
yes.
they keep person going around from a professional to another profession and then another profession, spending money instead of using that tool that we exactly know that works. And that tool has a specific name. It's called hypnosis.
Excellent. Well, that's wonderful advice, Antonio, and thank you so
Thank you.
much for that. If um, anyone watching or listening would like to contact you, and I'll put all your details, by the way, in the show notes and in the narrative at the bottom of the podcast and on YouTube as well. How can we contact you?
By phone
Okay.
or by email.
Yeah.
So
And you have you have a website, don't you?
yes, yes, and
And I'll put that on it as well.
yes, yes, yes.
Okay.
Istitutoipnosi.it.
.it. I have that, so I'll put that in the notes. Um, Antonio Allegretta, thank you so much for Dr. Antonio. Thank you so much for today.
You're welcome. I thank you, Aidan.
And I look forward to the next time that we do this. And I'll say bye bye for now.
Okay. Have a good day. Thank you so very much.
You have been listening to the Professional Hypnotherapist Podcast, a production of the European Association of Professional Hypnotherapists. That's EAPH.IE. And I have been your host, Aidan Noon. why not pop over to eaph.ie and take a look at our many therapists just waiting for you to contact them. That's all for now. Bye-bye until next time, and take care.